primarily look at the development of motor control and coordination in children, both typically developing and atypically developing children. So I've focused on populations that have not received a lot of empirical attention in terms of motor issues. So I've looked at children with learning disabilities, dyslexia, autism, developmental coordination disorder. So basically trying to look at how they develop gross motor coordination. And my ultimate goal is to try to find a way to diagnose learning disabilities or help diagnose learning disabilities earlier on by looking at the motor system, because the motor system develops sooner than language or other means of communication. So by examining the motor system, that should give us a window into whatever the underlying factors are that ultimately lead to learning disabilities. So that was my kind of my focus way back since the start of my career. I moved into, I was looking at whole body coordination. Again, because whole body coordination emerges sooner than fine motor coordination, so it should give us a good window into whatever the disorder is. So I did a lot of my early research looking at multi-limb coordination, dual motor task coordination, and somewhere around 2008 or 2009, more at the link between cognitive activity and motor behavior. So I needed to find a way to look at that brain behavior link, and I started learning how to use functional near infrared spectroscopy, or FNIRS. Since 2010, I've been learning the technique, and also in 2013 I got a FNIRS unit, and I've just gotten some of my first publications out looking at that brain and behavior link.
Next question, please. Next question, please.